Good morning and welcome to another session of Heart to Heart. It's my pleasure to introduce Dawn Denicola, nurse practitioner. Dawn trained at Loyola University in Southeastern, and Dr. Andrew Smith, a cardiologist here in Baton Rouge, and Dr. Smith trained at Vanderbilt University in Nashville and went to medical school in New Orleans, LSU. Welcome both.
Thank you.
Thank you.
So tell me about the new heart care center that you have both helped set up here in Baton Rouge.
Well, we've just begun it. Really, just started a collaboration with the Cardiometabolic Alliance, which is a national institution with I think about 20 different groups around the country that really focus with a team-based approach on diabetes, hypertension, and hyperlipidemia to try to improve overall cardiac outcomes with that team-based and yet focused approach in those three problems.
So here in southeastern Louisiana, we've seen unfortunately a rise in cardiovascular disease, particularly an increase in both high blood pressure, diabetes, and a reversal, unfortunately. For a while we had smoking cessation declining, but now we're seeing increase in use of tobacco products. So we have a lot of work to do here, not only in our local communities, but within our state. So Dawn, how does treatment for high blood pressure, what efforts have y'all put together that can help patients in our community with resistant hypertension?
We've put together a boot camp of sorts for these patients who come through. We work with them in addition to their primary care doctor to come in and focus. These are patients that may already be on 2 or 3 blood pressure medications and they are still not at goal. So they come in and they're able to see a physician, a nurse practitioner. We can do dietary instruction with them with one of our employees, and also speak with pharmacy if they have questions about medications or how to take them and side effects and such.
So diet and exercise are clearly important, but you've also got some new tools for remote monitoring and being able to interact without necessarily having a patient in the office with you.
Absolutely. This is really exciting. We have the remote blood pressure monitoring where we give the patient a cuff, we set them up, and they check their blood pressure, and it remotes into a website that we check. When we set alerts for them when their blood pressure is over that goal, it comes to us and we're able to look at it. We can either message them on the computer or call them on the phone. They can send us messages as well to quickly up-titrate those medications if needed instead of bringing them to the office, every week or every 2 weeks.
That's excellent.
Yeah.
That's fantastic. Dr. Smith, treating cholesterol, we've often had just 1 or 2 groups of medications. You've combined diet and exercise, but also a new approach to treating these patients, beginning with maybe using new techniques to find out their risk. Tell us a little bit about that.
Well, over the last decade or so, the guidelines have really we've begun to understand that you really have to get tight control of the lipid profile, specifically LDL and ApoB particles, to really reduce that risk. And over the last decade, we've had a lot of new tools. We have PCSK9 inhibitors. We have inclisiran, which is also PCSK9 inhibitor in a different fashion. And with that, we're really able to obtain these goals. And you've also still, Danny, got to go back to diet and lifestyle. And I think through this Cardiometabolic Alliance and this more team-based approach where we have, exercise physiologists, we have pharmacists in-house who can really help teach these patients lifestyle, adherence to medications, and how important that is. So you kind of start with those basics, and I think some of the patients we're going to be able to reach goals with that. Or maybe it's just they're on a Lipitor, which is an old statin medication, and just getting it to the proper dose to get it to that high dose for those higher risk patients to get that LDL at least under 70, maybe even under 55 now. And if that's not effective, then you add these newer medications that we have available.
Of course, diabetes is unfortunately increasing in our younger population and in general in our patients. So for diabetic patients that have had difficulty reaching control, what can the Heart Care Center and the Cardiometabolic Alliance offer these patients?
So the idea is that our diabetic patients are such high risk for heart disease that we are treating the patients that have coronary disease, but their hemoglobin A1C is not to goal, which represents what their blood sugar is. So we bring them in and really work with them closely with sort of a boot camp approach too. We have, again, pharmacy, dietary, and everyone who speaks with them, but also with medications to help them get to their goal quickly.
So a typical visit at the Heart Care Center will involve seeing physicians and nurse practitioners to set the program in place, and then you surround the patient with a lot of support, it sounds like, with nutritionists, clinical pharmacists, and exercise physiologists.
Yeah, some of
That's
their
re-
appointments that they come back, they'll be
Yeah,
meeting with
that-
those people instead of the physicians, correct?
And in terms of outcomes and results, have you seen any exciting results to let us know about in some of the patients that you've treated?
Well, you know, we're just getting this started, so I mean, it's just personal experience with my own patient, but certainly the lines, if you look at their numbers, their adherence to medical therapy, their hemoglobin A1C numbers over the first 6 months of therapy have really been dramatically improved. I think it's important to put out, to just state, you know, we're not taking over for the primary care doctor or the cardiologist. We're focusing on these problems for usually a 6 to 12 month period, and then their primary doctor or primary cardiologist is taking that patient's care over
Dr.
again.
Smith, the Heart Care Center is really comprised of multiple different people helping to direct the whole team.
Yeah, I think we've mentioned nurse practitioners and pharmacists, but we haven't mentioned that we also are partnering with endocrinologists and primary care doctors as well. So it's a physician multi-specialty team, as well as integral other professionals that are in different
Well, with
parts of
these
medicine.
very complex diseases, having a Heart Care Center that can help move these patients on, help clinicians take care of their patients is extremely exciting. So I want to thank you both very much for putting this together, and look forward to maybe catching up to see how you guys are getting on in about a year or so. Well, thank you very much for spending some time with me this morning. If patients or primary care doctors or folks want to refer themselves to the Heart Care Center, how might they get in touch with you?
They can go ahead and call our main office. It's 225-767-3900, and they can get them set up with the right appointment.
That ends another session of Heart to Heart. Thank you for watching, and looking forward to the next session.